Hello there, Dr. Zakir Hussain with you, and the topic is nasal haemangiopericytoma. Let me give a small introduction before starting the topic so that you can understand better. The tube or the vessel which carries blood away from the heart is called as artery, and all this blood will be collected from the cells and it will be returned to the heart through a tube called vein. So this is an artery which carries blood away from the heart, and this is a vessel which carries all the blood back to the heart. So you have an artery, you have a vein. There are small connections between the arteries and veins, very small ones. These are called the capillaries. When you have a benign lesion, in the capillary, in the covering of the capillary, it is called as haemangiopericytoma. Now, the importance of this condition, that is, we are mainly going to discuss about nasal haemangiopericytoma. The importance of this condition is, there is a 10% chance that it can turn malignant. So, benign means it is not malignant, but chances of it becoming malignancy is always there. So, there is a 10% possibility that it can turn into malignant. And after surgery or removal of the complete lesion, there is almost 50% chance that can recur to. So that is the importance of this condition. Usually it affects the age group of more than 60, and there is no specific etiological or causative factor for this. The common presentation is there is a spontaneous nasal bleed, and that too it is unprovoked, and usually it stops after some time. And the same side, the patient experiences nasal block too, and this bleed recurs again and again. So when the patient comes to us, we'll do a nasal endoscopy. So on examination with endoscopy, we will have a look of the nasal cavity. That time you can see a grey or reddish polypoidal mass in the nasal cavity, and this usually bleeds on touch. So we will take an MRI scan to know the characteristics of the lesion as well as the extent of the lesion. This is a helper for the surgery. Now, to come to a specific diagnosis, we need a biopsy, which cannot be done in the OPD because it may bleed profusely. So what we'll do is, the treatment for this is wide excision, removal of the lesion and removal of some other normal parts too. So once we remove the lesion, the whole specimen has to be sent for histopathological examination. That's why I have mentioned as excision biopsy. So the treatment is going to be complete removal. So this is how we manage a case of nasal haemangiopericytoma. Thank you so much.